Hi everyone, I am Dr. Charanjit Kaur from Khalsa College of Pharmacy. I am going to deliver the lecture on anatomy of the heart along with its disorders. Heart is a roughly cone-shaped hollow muscular organ. It lies in the thoracic cavity. It is approximately 12 cm long, 9 cm wide and 6 cm thick. Heart lies in the thoracic cavity in the mediastinum. The position of the heart is oblique and more towards the left side. The apex of the heart is anterior, inferior and towards the left, whereas base is superior, inferior and towards the right. The surface of the heart is associated with various organs. Layers of the heart. Outer is pericardium, it protects the heart, whereas middle is myocardium, it consists of cardiac muscle tissue. The cardiac muscle, they are involuntary, striated and branched. The branches of the cardiac muscle, they branch with the various tissues. The point of the union of the branches is known as intercalated disc. Endocardium, this is the inner layer of the heart. It covers the chambers and walls of the heart. Chambers of the heart. Heart consists of 4 chambers, 2 atrium and 2 ventricle. The superior 2 chambers, they are known as right atrium and right ventricle. The right and left side, they are separated by a fibrous septum so that blood cannot cross from one side to the other. Each atrium has a pouch-like structure which is known as auricle. The right atrium receives deoxygenated blood from superior vena cava. It receives the blood through the following 3 veins: superior vena cava, inferior vena cava and the coronary sinus. The blood in the right atrium flows into the right ventricle and then the right ventricle pumps the blood into pulmonary arteries. These arteries, they carry the deoxygenated blood to the lungs. The oxygenated blood returns to the heart via pulmonary veins. This is the only exception where the arteries carry venous blood and the veins carry oxygenated blood. The blood from the left atrium flows into the left ventricle and the left ventricle pumps the blood into the systemic aorta. Valves of the heart. The valves of the heart permit the flow of blood in only one direction. There are 4 valves: atrioventricular valves and semilunar valves. The AV valves, they separate atrium and the ventricle. The valve between right atrium and right ventricle is known as tricuspid valve. The AV valves between the left atrium and the left ventricle is known as bicuspid or mitral valve. These cusps, they are connected further to the tendon-like cords which is known as chordae tendineae. These chordae tendineae, they are joined to the papillary muscles. The papillary muscle play an important role in the closure of the cusp, thus preventing the backflow of the blood. The valve between atria and ventricle open and close in response to the pressure changes. Semilunar valve. These valves, they are present at the opening of systemic aorta and pulmonary artery. They are known as semilunar valve because of their half-moon shape. Both these semilunar valves, they have similar structure and each one has 3 cusps which allows the blood to flow only in one direction. Disorder of the cardiovascular system. First is coronary artery disease. It is also known as atherosclerosis. In this condition, a plaque builds inside the coronary arteries. It is a serious medical condition which affects about 1 million of people annually. It affects both men as well as women. Plaque is made up of fat, cholesterol and calcium. When plaque builds inside the arteries, this condition is known as atherosclerosis. Plaque narrows the artery and thus causes the reduction of the blood flow. Gradually, narrowing of the arteries may also cause formation of the blood clot inside the coronary arteries. This condition may lead to the serious complications. Angina, it is chest pain or discomfort in the heart. It may feel like pressure and pain in the chest. Heart attack, it occurs when blood flow to the coronary artery is completely blocked. This prevents oxygen-rich blood from reaching to the area of the heart muscle. Signs and symptoms of the coronary artery disease: shortness of breath, angina. Sometimes it can be also diagnosed with the symptoms of the heart attack. Major risk factor of the coronary artery disease: high cholesterol level, high blood pressure, smoking, diabetes, overweight or obesity, lack of physical activity, age. In men, the risk of coronary artery diseases increases after age of 45, whereas in women, it increases after the age of 55. Family history, sleep apnea. It is the disorder when breathing stops or get very shallow while sleeping. Untreated sleep apnea, it can increases the risk of high blood pressure, stress and alcohol. Diagnostic test for coronary artery disease, ECG. It is a test that detects and records the electrical activity of the heart. Stress testing. In this test, the functioning of the heart is monitored when placed under physical stress by exercising. These abnormal changes in the heart rate, blood pressure and heart rhythm, they are considered. Chest rate. This can reveal any symptom of the heart failure. Blood tests, they determine the level of the fat, cholesterol and sugar in blood. Coronary angiography, this test uses the dye and special X-ray to detect the blood flow through the coronary arteries. Treatment of coronary artery disease. Lifestyle changes, that is increased physical activity, losing weight, eating healthy diet and smoking. Medicines may include anticoagulants and antiplatelet medicines and other supplements rich in omega-3 fatty acid. Medical procedures include angioplasty, coronary artery bypass grafting. Congestive heart failure. It is defined as inability of the heart to supply sufficient blood flow to meet the body needs. It is a common, disabling and potentially deadly condition. Heart failure can be right-sided or left-sided. The common causes of the heart failure include myocardial infarction, ischemic heart disease, hypertension and cardiomyopathy. Various symptoms of the heart failure, they are shortness of breath, fatigue, cough, fluid accumulation, lung congestion, heart enlargement and exercise intolerance. Cardiac murmurs. They are the abnormal heart sounds produced because of the changed pattern of the blood flow. It is usually present when heart valve, there is a problem in the heart valve, and it can be heard using a stethoscope. They can be cause heart attack, blood pressure, rheumatic fever, pregnancy or anemia. There are two types of the cardiac murmurs, diastolic and systolic. Diastolic murmur, it usually occurs after second heart sound, whereas systolic murmur, they occur between first and second heart sound and is produced during systole. Cardiac murmur occurs when the valve does not open properly. If a valve does not open, less amount of the blood can pass through a smaller opening. If a valve does not close tightly, blood may leak backwards. It causes the regurgitation of the blood. These problems can cause the heart to work harder to pump the same amount of the blood. Pericarditis. It is inflammation of the pericardium. The following may be the causes of the pericardium. Infection due to viral, bacterial or fungal infection. Immunological condition, trauma to the heart, side effects of some medicines. Myocarditis, it is the inflammation of the myocardium that is caused by infection of the heart muscle by virus or some immune diseases. The various symptoms of the myocarditis include pain in the chest, fever, fatigue, joint pain and breathlessness. When myocarditis is more severe, it leads to weakening of the heart muscle and cause heart failure and heart rhythm irregularities. Endocarditis. Endocarditis is inflammation of the lining of the heart chambers and heart valves. The symptoms of the endocarditis include excessive sweating, fatigue, fever, chills, abnormal urine color and muscle pain. Ischemic heart disease. Ischemia in the heart mainly occurs due to the formation of the plaque, which may cause narrowing or occlusion of the artery. The complication due to ischemia depends on the size of the coronary artery involved, on the extent of the plaque deposition. Narrowing of the coronary artery disease, it leads to angina pectoralis, whereas obstruction leads to myocardial infarction. Angina, it is a condition of severe pain that occurs due to narrowing of the coronary artery, in which the person is unable to meet the heart requirements. The pain may start in the chest as a tightness and may spread to the neck and towards the chin, and from the neck it spreads to the left arm towards the elbow. Myocardial infarction. It is the complete obstruction to the blood flow in a coronary artery, and it may lead to the death of the cardiac muscle tissue. The damage due to myocardial infarction is permanent, as the cardiac muscle cannot regenerate, and thus the dead muscle is replaced with non-functional fibrous tissue. Cardiac arrhythmia. It is the disorder or rhythm of the heart rate. The heart may beat irregularly, too fast or too slow. The symptoms of the cardiac arrhythmia include chest pain, shortness of breath, dizziness and fainting. The different categories of the arrhythmia, they are bradycardia, it refers to slow heart rate; tachycardia, it refers to rapid heart rate; fibrillation, it refers to rapid irregular heartbeat; atrial arrhythmia, it originates in the atria; and ventricular arrhythmia, it originates in the ventricles. Thank you everyone.